Puleng Molebatsi, your driver or the captain of the ship this morning as we head towards 12 midday, where we park it for the week and then we resume our journey again, every single weekend. So Dr. Jessica Hamuy Blanco is a medical doctor and product as well as clinical risk executive at Dis-Chem, and we're talking about preventative care this morning. Thank you so much, Doctor, and welcome to Out and About.
Hi, Puleng. Thank you so much for having me.
Thank you so much for joining us. Doctor, I want us to begin this conversation right here. What is preventative care?
So, preventative care is really talking about the steps that you take, before you really notice any obvious symptoms or signs of disease or of specific conditions. So it's really trying to identify issues as early as possible so that you can manage them to the best of your ability. So it's about taking steps before you notice a problem.
All right. And, I said earlier on, the body whispers before it screams. And I would like you to explain what that means in medical terms, and what kind of subtle signs do people usually then overlook? I know one of them is like a headache.
Sure. Yeah, absolutely. And that kind of line that you mentioned, the body whispers before it screams, it's really so relevant in the sense that if you think about the kind of things we would be trying to prevent, for example, heart attacks, strokes, advanced cancers, those things start developing in the body early on and they progress over many, many, many years. So by the time they reach the advanced stage, you've kind of gone through this long period of time where you may have been able to pick them up, but you weren't really feeling anything. So the body kind of whispering is some of those more subtle kind of signs that you might notice that are indicating to you that you need to kind of get something checked out, you need to get something looked at. That can be various different things. It can be, you may start losing weight, you may feel more tired than usual, you may notice some pain in certain instances. But the real thing to take note of is that often there's no signs or symptoms at all. So you might have heard things like high blood pressure and high cholesterol kind of referred to as the silent killers. And the reason they call that is because for so many years you can notice absolutely nothing. And that's why it's so important to prioritize screenings and prioritize preventative care in your life so that you go and get checked up on a regular basis, even if you feel perfectly fine.
Oh, so you don't have to feel something for you to go for regular checkups?
Absolutely not. And I think that's a really important message. Obviously, if you notice anything out of the ordinary, and sometimes that can be subtle in itself, it's advisable to go and get a checkup. But even if you feel perfectly fine, there really are steps that you need to take on a regular basis. And really, we're talking about, sort of once a year going to have a screening, getting your glucose tested, your blood pressure, your weight, your cholesterol levels. And that would be advisable for someone who is otherwise perfectly healthy and has no real big risk factors that they can identify. For people who are, for example, overweight, who smoke, who might have a family history of certain conditions or certain cancers, in those instances, it's advisable to go and get screenings potentially even more frequently and definitely not less than once a year. So, it doesn't need you to wait for something to be noticeable. And I think that's really the take-home message, is that you can feel fine. And it's very easy to deprioritize screenings. We know life gets busy. We know there's a cost sometimes associated with it. But it really is important that becomes a priority to prevent more serious things from happening later on.
Okay. So Doctor, I also want to know, how often then should an average person then go for general health checkups? And does it vary by age or risk factors? You spoke about maybe knowing your family's medical history.
Yes, so it definitely does vary from person to person. There are general guidelines that make sense kind of for the average person. Typically, an adult should be going for a general screening at least once a year. And that would generally, consist of those tests that I mentioned: your glucose, blood pressure, cholesterol, your weight. And then above certain ages, and also kind of differs by gender, there may be specific tests that now become relevant. So for example, for a male over the age of 45, it's recommended that they go for prostate screenings to look for signs of prostate cancer at a certain frequency. And for females, then things like breast examinations, pap smears, those things become relevant too. And for both men and women, screening for colorectal cancer as well over a certain age becomes relevant. So it does vary in certain instances, but what is very useful to know is that if you are going regularly for a screening, it gives you the opportunity to ask the nurse, ask the doctor, are there any additional things that I should be considering in my specific context? They can then ask more about your family history, your own individual risk factors, and then they will be in a better position to kind of advise you on anything else that you might need to consider.
Oh, okay. I mean, I think I do know, like at a certain age with ladies, for sure, that you need to check for specific things.
Yes.
How do I know if I'm obese? I know it goes with like BMI, and you have to be formally diagnosed with obesity, or is it just a visible like sign? Like if I'm like, you know how people are like, oh, I'm so obese.
Sure. Yeah, I mean, it's a good question, because I'm sure it's something that a lot of people have kind of asked. It is something that actually does need to be kind of considered actually as a chronic condition, and it's being more widely accepted that that's how it needs to be looked at. It's not really that feasible to kind of just look at a person and say, okay, you're obese. It is advisable that the actual measurements get taken, and as much as your actual weight is one of the indicators, it has to be looked at together with things like your height, your body fat percentage. All of those things come into the picture to really kind of identify sort of the risk that it confers to you. And it also needs to be then managed appropriately. So it's one thing saying, okay, we've identified that this person is obese. There needs to then be a proper management plan that gets put together in the same way that you would look at management of high blood pressure or diabetes. It needs to kind of have a proper approach and proper monitoring as well.
Oh, okay. And so what kind of preventative services or checkups and options are available for those wanting to start taking better care of their health? Where can I go? Because money is also a big factor. And I guess for people, not everyone has medical aid. If maybe for people with medical aid, they're motivated because it's like, that's my money. I might as well put my money to good use. Let me just go check. For people that don't have medical aid, you're like, thank God I feel better today. Hey, medical aid is expensive. Where does one go? Where it's affordable?
Yeah, it's a fantastic question and so relevant to our country's context, right? So definitely if someone is on medical aid, a lot of the time there is a wellness benefit that's included as part of the package, and that allows someone to go to a GP or to a clinic and get a kind of wellness check done. And certain other screening tests may form part of that package too. If someone is not on a medical aid, generally they would be interested in looking for kind of lower cost options than going to attend a GP, for example. And if you think about the offering that exists in a Dis-Chem clinic, it's possible to see a nurse for 94 Rand and get these tests done. So that also presents an option. And then there are other funding options outside of the medical aid space. So at the moment, medical insurance is still a relatively new funding product to the market, but it presents an option that is at a far lower price point for people to still have certain benefits like wellness screenings that they can do in a private clinic or with a GP. And then obviously for people where affordability may be even more of an issue, there is the option of attending a public facility like a community health center or a clinic, and to get those tests done there. So it really kind of depends on the individual's context, but I think the availability of lower cost options is becoming something that's a little bit more common. And yes, there's still a lot of work to be done, but I think the idea is that we need to enable more people to do these kind of tests, because ultimately as a community, as a country, we would all benefit significantly if more people went and did screenings and we picked up issues earlier on, rather than waiting for them to become more and more advanced at a point where there's more risk and they're ultimately more expensive to manage as well.
Right, Doctor, thank you so much for chatting to us this morning on Out and About. And, I think in this day and age, with information just really available, the money then becomes a factor. And then we also get distracted by things like Google and ChatGPT, where you think you can just Google your symptoms and it's sorted. You don't even, you're like, oh, well, it's not a big deal. Okay, let's carry on. So it's best to still keep it traditional. Go see a specialist.
Absolutely. And I think, the last thing I'd really want to, have everyone kind of take home from this conversation is that it's very easy to, kind of have the sense that all of these things that we're talking about kind of happen to other people. They're not going to happen to me. And it just tends to be human nature. It's very easy to advise someone else to go for a screening and not do it yourself because you just don't kind of imagine that it's going to happen to me. And I think that's just a dangerous mindset for us to have. We've all got to really take responsibility for our own health and make sure that we kind of practice what we preach and we all kind of go and do these screenings. It really is one of the best actions we can take for our health.
All right, Doctor, once again, thank you so much for joining us this morning on Out and About.
Thank you so much. Bye.
It is Dr. Jessica and Hamuy Blanco, who is a medical doctor and product as well as clinical risk executive at Dis-Chem, bringing us now to 27 minutes before top of the hour, 11 Central African time. I'm still Puleng Molebatsi. Nothing has changed. However, I want to steer your attention to this. Have you ever been persuaded into something by someone that you have seen on an experience or an encounter? I do not share my own experience like an hour ago.